couldn't be more excited to be a part of this panel. I, as she mentioned, have a human rights firm, and I've worked in close to 50 countries at this point. And so the opportunity during a week like this in San Francisco, where we hear so much about very specific solutions to very specific problems, I love this opportunity to take a big step back and give patients a voice literally all over the world. And everyone in this room knows that, starting a company is hard enough. Being a successful entrepreneur in healthcare is near impossible. And these three individuals have managed to do that across borders, across cultures, languages, and in some cases, across continents. And so I think we have a lot to learn from them. So I want to jump right in. And I want to start broad, especially given the theme this year. You're all working on different moonshots, but at the end of the day, you're all focused on improving access. And could be a handheld device, it could be working with clinics. So I want to ask you, in your regions, what does collaboration look like? And I'll start with you, Javier.
Sure. Well, in Latin America, collaboration is key to get this rolling. Access problem in our region is so huge. For people, it can take from a day to a week to just talk to a doctor, and it is really expensive for most of us. Another significant data is only 5% of the people are able to afford private insurance. So for us, collaboration, 5 years ago when we started, was trying to align all those players that have some interest in fixing this problem in some way or another. So by aligning the goals, we've been able to work with health insurance companies because they're trying to save costs but also grow their markets. Providers, because they need more efficiency, because we don't, in Latin America, also have enough providers. Government, because the space is sometimes gray and regulation is not there. And with so many other institutions that are basically trying to fix a problem, having a person in the center. So in our case, at Undoc3, we don't talk about patients, we talk about users. We try to provide a user experience for them so they can, at any time, be able to talk to a doctor just by using their phone, just chatting with the doctor, in the middle having AI to optimize doctor's time and some other resources that are not only provided by us, but so many players.
And what about you? What's collaboration look like?
That's a good question, Nicole. So I'm from Southeast Asia, and heart disease is still the #1 killer of both men and women, and it really pains me as a cardiologist because we do have the medications to treat it if we could just detect it early enough. Not just that, but in Southeast Asia, everyone's getting the heart disease, even heart failure, at least a decade early. And so there's plenty of time to really intervene if only there was access to the detection of heart disease. And so collaboration involves, I think, 3 partners to me. One is the doctor, who will embrace, please, decision support and technology to help us do this better. Secondly would be health systems. And health systems really have to start thinking about going upstream, about preventive care, about predictive analytics based on what we can see. And then the third actually is big pharma. Because big pharma have the drugs. They're not being implemented, especially in places in Southeast Asia like Indonesia, Thailand, and I could go on. So
Interesting.
Hi. We've taken collaboration in a very different way when we decided to build CliniVantage as a company. And we've seen collaboration means different things across different continents because we operate on 3 different continents today. For us, the core of our ecosystem was to bring different players, different healthcare players, different family members together to actually solve the problem. And I'll give an example. We're working in rural health sector in India, and we've done 60,000 outpatient care sessions at a cost of less than $1 each. Now, this wasn't possible if we didn't have the right payer mechanism, if we didn't have the right doctors, we didn't have the right health workers, we didn't have the right family members, and if we didn't have the right technology. So what we've done is we've taken every aspect of what it takes to deliver care and timely care. So, what was an important part of what we did in terms of collaboration was not just to identify that the last mile care is required, but actually how do you get it in time and how the interventions are done in time. And that was the biggest difference we saw is when we talk about collaboration is about getting different aspects of the care delivery mechanism.
So maybe you could give a tangible example. So, you mentioned pharma, and so those are very different than some of the on-the-ground, small clinic-type collaborations. I mean, those are still very structured and rigid, like we think here in the US. So can you give us each an example of someone you collaborate with?
Well, I'd love to give a vivid picture of this. So picture maybe not so much structure, but a mobile bus almost, going out with nurses who may not be medically trained in ultrasound of the heart or echo, which is what we do, but equipped with the AI and with the handheld tools to be able to screen patients in the community. And health systems then identifying those patients, giving preventive care, and all supported by pharma who actually have the drugs that can effectively prevent heart disease in these patients. And the reason for involving pharma is, they too need a way to implement and get the drugs to the right people. And so that would be one moonshot dream of ours, to actually put our AI on handhelds, enabling echocardiography, which is really the safest, commonest tool that cardiologists use to screen heart disease, enabling that to be just democratized and really put even in the hands of untrained persons.
So I have a great example to talk about this. The kind of work that we're doing, if you focus on public health in the country of Bangladesh and in India, is really about empowering the clinics, empowering the health workers. We are talking about a small clinic in a 10 by 10 setting. And if you look at the technology in terms of hardware, we've got enough hardware that actually will let you do last mile diagnostics. Things that used to take 1 or 2 trips to a doctor, maybe a couple of days, 24 hours to 48 hours to get the results, can be done within 30 minutes. So we actually deployed health ATMs along with our devices and our technology platform to let the health worker actually do the last mile diagnostics, push the data back to the district hospital where you have the doctor who's a specialist actually consulting with the patient in real time. So what we've done is we've actually used technology to bring doctors into the homes or into the villages and districts. And that's a big shift in terms of what Dr. David was talking about a while ago, is how do you change the ecosystem where you bring care into the homes? I think technology is there. And we've integrated with 45 different devices that actually bring the cost down. So when you look at our moonshot, it's not just access to care, but cost to zero. And we've done OPD sessions which are less than $1. We can do some of the diagnostics, which a lab in India is going to charge you $10, and it can be done within 50 cents. Right? So we've seen that kind of transformation with technology coming with people and getting the right players together. And the most important part that we've seen is getting the right players together, is getting the right people together, getting the right infrastructure together, getting the right devices together, and the technology to make it all work.
Well, in our case, I would say that working with insurance companies, you have to deliver. And in our case, collaborating with them is basically showing that this tool and this partnership is actually working. So we measure very deeply what is the impact they're having from the collaboration. So we've seen an insurance company in Colombia that the cohorts that are using our medical advice product are using 11% less physical resources. So it's working for them, it's working for us, and it's working for the people. And another quick example is that we have around 1 million people using our platform a month. So 30% of that is actually teenagers asking about sex-related questions. So we collaborate with the United Nations Population Fund in trying to fight unplanned pregnancies in our region. Why? Because we are having the users, they're having the goals to fight this problem, and basically what we're doing is delivering information and helping teenagers have a different life. So it's basically aligning the objectives and trying to do our best. And we could go on with many more examples, but basically we're just looking for alignment.
Nice. So you said 1 million monthly users. So Nilesh, I don't want to pick on you, but I've lived in India and worked in Bangladesh. And so as you mention these numbers, you as an organization, I know, have set a goal of 10 million patient records in a place like India. There's just so densely populated. Like, how do you measure, or how do you set metrics for success, both for the patient populations and for yourself? I guess, how do you measure impact?
Yes.
So I'll start with you.
I think that's a great question. We keep struggling as a startup. How do we measure success for ourselves as well as our customers and our patients, right? When we look at it from a patient perspective, we're actually looking at time to intervention. So it's not just access to care, but how long did it take for us to actually intervene into the process? So if you look at every episode, that's one metric we look at. The second metric we look at is number of visits per episode. We want to bring that down. I'll give an example. When we looked at diabetic care, typically in India, it takes 3 to 4 visits before you get assessed as being a diabetic patient and get medication. We can bring that down to 2 visits, right? And that's a huge impact on one, cost for the patient, as well as the entire cost for the ecosystem. And also intervention time. It's much faster if a lot of the tests, a lot of the consultation can be done with the right experts and in the location that they are. So that's one of the metrics, 2 of the metrics that we're looking at from a patient perspective. If you ask from a CliniVantage perspective, we're very focused on number of transactions that happen on a platform. So one of the first companies that actually have created an end-to-end ecosystem where we've got consumer devices with the clinic solutions, so practice management solutions, EHR, PHR, OT solutions, admin, non-admin, clinical. Everything is on a single platform, which means we only focus on number of transactions that happen on our platform. And our goal is to get to about 1 million transactions a day in the next 2 years. And we'll probably get there because the way we're approaching the problem is getting more hospitals, more clinics, and more doctors adopt to our system and process.
And how do you measure impact?
Wow, it's hard to go after you, Nilesh, but I start with the patient level as well, and with our little screening bus, and that's going to become a reality, I believe. The number of patients in whom disease is detected when they were previously unknown. In other words, the number of clinical events prevented. So that would be on the patient level. On a health system level, eko.ai turns a process that's like 30 minutes per patient, 250 clicks from a doctor for a single patient, and more than 20% variability in results between 2 doctors, turns all of that into just 2 minutes, a single click, and 0 variability. And so with that kind of accuracy and increased productivity, it's hoped that health systems can really sort of reduce the waiting time for a simple thing like ultrasound of the heart, and and just get it out into the general and community. But last level is on the big pharma level. Now, I really think that we are wasting too much money in large clinical trials in cardiology. I mean, we have trapped ourselves in this mega trial expectation, and it's really detrimental. And part of it is we use echocardiography as a surrogate outcome to screen patients for eligibility into trials and so on. So I want to just cut the cost of all of that, accelerate drug development, and accelerate implementation of the right drugs to the right patients. And that would be on the macro level.
Well, in our case, probably serving 1 million people a month it's how we measure impact from the user perspective. Not only because the number is big, but also because 22% return to the platform within the next 3 months. So it means that we help them. And when instead of just going to an ER in Latin America, when you maybe have to commute for 2 or 3 hours, spend $2 or $3 on transportation, instead of that being able to chat with the doctor, well, that's not only, that has an economic impact also as well, and it is huge, and that's why people love the service and come back. On the other side, from the business model perspective, working already with 6 insurance companies in the region, and being able to measure that we are saving cost and improving user experience at the same time, because it's not only about the cost, but also, only 5% of people can afford private insurance, but the service is not very good. So helping there to improve the customer care metrics is also important. For us, this is just the beginning. We are trying to improve access in our region in a way that there is no barrier at all when you need to talk to a doctor, and that's what we're doing.
So something that I was thinking of as you were all giving those examples is, as you think about growth, it's really about trust. I mean, the numbers you guys, all three of you are just so impressive in the sorts of metrics you're aiming for or have already achieved. And yet, to expand, you've got to build relationships. And I think that's something that we all understand, and here in the US, we have to do that as well. But in a lot of these places, everything you make or break based on the relationships you have, the advocates, the stakeholders, and I often call them promoters, and because they go in front of you, right, in many cases. So you mentioned, I'm going to come back to that, you mentioned the UN, and you've got, I know, some really interesting promoters that help along the way. So how do you build that trust with those advocates that are on the ground even when you're not there?
Well, we look for someone that is, it's usually people. It's not an organization.
Right.
So what we do is we look for the right person that has the same, willing to fix the same problem. And then what we both looking is for validation. Maybe you are inside of the UN and you're trying to fix a problem, but it's a very bureaucratic organization, right? So best way or the fastest way to get something done is probably work with a startup, try something out. And for us, it's validation because it's the UN trusting our service. And then helping a lot of people also give some validation. So basically, in Latin America, when we are, I don't know how many years behind everything what is happening here, building trust with not only with the users because they're now having access and they love it, but also with the regulators, with the whole system, it is very important. So looking for some stamps, we call it the stamps. Now we're working with this and this, so everybody now is able to trust that we're not just developers answering or providing answers, medical answers, but we're real doctors and we're real people providing good service.
Okay. What about the two of you?
I think for us, building the right ecosystem with the right trust was going back to laser sharp execution and very high integrity and honesty. Because one, being a startup in the medical field is not an easy answer to the doctors, but also establishing that ecosystem of trust within the partners and the collaborators that we have, it did boil down to how we're executing actually on the ground, right? Which means the health worker willing to trust us with the entire ecosystem that we're building, the doctor who's behind the screen, having his trust in terms of how we're executing down to the last mile. The kind of medications that we're bringing in, having that trust that they're not expired or not rebranded, especially coming from developing countries, these are the challenges and problems that we've seen. So I think it fundamentally goes back to how you're going to be executing with the partners and the collaborators that you have, how honest and transparent you are with them, because if you're not transparent, I think growing in these environments is going to be extremely challenging.
Nicole, my first reaction was very similar to Nilesh's. I was just, by building the best darn product you could think of. And I say this with a lot of humility because my greatest skeptics are my own fellow cardiologists and clinical trialists. And so what we've done is we've gone straight to them. And because they're also the KOLs and the respected ones who publish and write the textbooks and so on, we've actually gone to them and partnered with their echo.ai labs, where also there are tons of stored images for machine learning. And we're actually going to validate our product in that, publish with them, and sort of hopefully turn our greatest skeptics into our promoters. From there, then go into the health systems. But that's sort of what we do.
So building upon that, and then also touching on what you said, we only have a few minutes left, but you mentioned regulators. And so as you say that, so there's not only the trust building at the community level and the peer level, but we hear enough complaint. I live in DC, right, with all of our agencies, cause enough problems. But you all work in spaces where, it can be pure chaos when it comes to regulation. Just to put it very politely, there are ministers of, administrations of health and education that just don't exist or don't function. So how do you work with, get advocates there, and partner with those regulatory bodies, particularly as you cross country borders?
It's an uphill battle. To work with the regulators and policymakers, and especially in the healthcare sector, is very sensitive, especially in countries like India, Bangladesh, and developing nations. But I think it's going back to establishing the trust, making sure that you're executing on the ground realities are met with. Because at the end of the day, when we had discussions with the policymakers and the state governments to showcase of how we can actually help them deliver public care. And at the end of the day, that's the goal, is how do we simplify the way care is delivered in both public and private settings, create transparency and bring transparency into the system. And I think once we crossed that bridge, the doors opened up. The discussion started happening, okay, how are we going to execute, what are we going to do? We've got invitations from ministries of health across different countries to start opening up these discussions of how we can deploy this in our country, right? And that only came after we were able to showcase and prove of how we can execute this, how this is done, and showcase examples. It's not easy actually to break that barrier. It's extremely difficult, especially because you've got the medical side, you've got the trust factor, you've got human lives at stake when you talk about practicing medical science, right?
Well, I think in our case, when it's not theory, but it's already real numbers that show an impact and people using it, there's a different way to start a conversation with the regulators. And also when we're out of Colombia, but we have operations in Mexico and some other countries in Latin America, and then we can tell the regulators of Mexico what's happening in Colombia and bring examples how it's been used in some other places that are similar. It also helps them to widen a little bit their perspective and be more open. And again, it's about finding the right people that is able or that is willing to really take a risk, because sometimes when you're talking to regulators, it's a safe place for them. So they don't want to make so many changes because it's not nice for them. So it's just finding, again, the right people and with the right data and trust, as you said, to start a conversation and take it from there to see how can we improve, and also be able to realize that all the changes that we want won't happen at the same time. It will take time, but we need to start taking steps moving forward.
Excellent.
Well, for us, we wanted to go global from the start, and so we're actually starting with the FDA. We find that we thought that would be the toughest nut to crack, and then from there, pivot to different areas, like in Singapore, Europe, and other areas. So starting with the FDA, and then also, again, with that trust word, we've got the network, because most of the individual countries will want to see data from their own population. And because of that, we've got a network of key opinion leaders and the top echo labs, which really, really is lovely, because that enables us to do a federated learning as well, to enhance the machine learning of our algorithms. So that's how we do it.
Excellent. Well, there's a lot of growth happening for all of you. So just to wrap up quickly, what are your 2020 goals in terms of growth?
Well, we're having 1 million users on our platform a month, 300,000 consultations. So we want to touch, by the end of 2020, 1 million consultations a month. And that's our main metric from users using our standalone platforms, and also our plugins, which are the service that we do with insurance companies. That's our main goal.
Okay.
Well, for us, we just closed our seed funding round, and so we're really gearing up to get going and about to announce major collaborations with Big Pharma, as well as a major health system in the U.S. So we're excited about that.
We
and
look
of course,
forward to hearing
FDA
that.
regulation.
So our goal for 2020 is to be cash flow positive, and also reach the target of 500,000 transactions a day.
Excellent.
Very simple, clear goals that we have set for ourselves.
All right, well, thank you all for joining us and for the conversation, and thank you all for being here. Let's give them a round of applause.
Thank you.